everybody. My name is Jerome. This is going to be your New York City mental health public service announcement. So I know I'm not the only one that, when we go into New York City or when we're in the city, we, walking the streets, or whether it's going into the subways or you're on the transit line or whatever the case may be, I feel like we run into things that are strange to us, right? And with that, we overlook these things. We don't really address these issues, and I want to make this announcement as a way to open our eyes and try to address these issues when it regards to mental health crisis amongst individuals. So like I said, when you're in New York City and you're running across the person that's, shouting at the top of their lungs, or, doing something crazy or dangerous or something like that, like, those are concerning factors, and we need to think about these things as we move forward, in time. So, some of us are going to have children and stuff like that that are going to be walking these same streets, and if we don't address the issues now, imagine what they're going to be like later on. So I researched a couple of things, and we're just going to touch on those. So I got this data from the National Institute of Mental Health, but it's the Substance Abuse and Mental Health Services Administration that is reporting this data. So mental health treatments received in the past year with U.S. adults in 2022 with any mental illnesses, the percentages are high, whether they're male, female, 18 through 50, Hispanic, black, white, or whatever. We have high percentages, so we could see that in the year of 2022 that, mental health is playing a factor in the United States. And here, I believe we're talking about from previous years the prevalence of mental health and how prevalent it was from previous years or from the past year. And as you can see, those numbers are decreased. So over time, I feel like we're coming out. We're acknowledging the fact that mental health is an issue that needs to be addressed, and something that just needs to be, have a light shined upon it. So in that data, we can see that in the year of 2022, based on the previous year, people are coming forward with acknowledging, mental health issues, whether they're seeking, treatment through substance abuse, or they're, have a mental health issue that's not associated with substance abuse, whatever the case may be. I would imagine that these numbers are going to continue to grow as this remains a social issue. There's going to be continuous research and data to be associated with this issue. So there's going to be continuous reports. Let's talk about New York City. And okay, this is straight from New York City's website. Keeping New Yorkers safe on our subways and maintaining confidence in the transit system that each day moves over 4 million people is key to ensuring that New York remains the safest big city in America, said Mayor Adams. When we came into office, we said the days of ignoring people in need on our streets and in our subways were over. Since then, we have continued to make mental health and public safety a focus of our administration and have delivered real results. The subways continue to be safer and safer. Year to date, subway crime is down over 5%, with almost a 9% decrease in September alone. With today's announcement of PATH, we are once again demonstrating our responsible approach to addressing the concerns of New Yorkers. Since launching less than 2 months ago, PATH has already made contact with 1,500 unhoused New Yorkers and delivered services to over 500 people. This is not only the compassionate thing to do, but the right thing to do. All this work builds on our efforts over the last 3 years to connect thousands of people experiencing unsheltered homelessness to permanent housing citywide. We will continue to make New York City a safer and more affordable city, and today's announcement is another example of how we are achieving that vision and delivering significant results. Since the beginning of our administration, we have been laser focused on creating outreach opportunities and supportive connections with people living in unsheltered environments, whether in our streets or on our subways, said Deputy Mayor for Health and Human Services and Williams Isom. These efforts include a focus on those with severe mental illness and helping folks get the care they need, even if they may not recognize their needs at a given moment. So I just want to give credit to New York City. Since the initiation of the PATH program, they've reached out to about 1,500 people, and out of that, we're able to deliver services to about 500 people, which allowed to get people off the streets into housing and stuff like that, address their mental health concerns and whatnot. I think that's great, but I think with a city that exceeds 8 million, 8 million people, I think we need to drive those numbers a lot higher, especially given the stabbing incident that happened in Manhattan about a month after Mayor Adams announced PATH initiative. Now, I know they don't directly connect with one another, but they indirectly connect, as this person was experiencing mental health crises, and we need to address these issues before they blow up out of proportion and, raise extreme level of concern. I'm going to read this to you guys. I got it from New York Times. On November 11th, a 51-year-old homeless man named Ramon Rivera, who had been charged with stealing a $1,500 acrylic bowl from a fancy furniture store in Manhattan, had a court-ordered appointment scheduled with his case manager. He did not show up, according to two people familiar with the matter. A week later, Mr. Rivera went on a rampage, stabbing 3 people to death as he stalked across Manhattan, the authorities said. He was indicted Friday on 3 counts of first-degree murder. Mr. Rivera's apparent descent into homicidal madness shows the difficulty that the medical and legal systems have in keeping track of some of the city's least stable people, ensuring they stay connected to care. So being that this is a public service announcement, I just want people to take away from this is that mental health is important. Whether it's you, a relative, a friend, or even a stranger, mental health is important. It impacts the people closest to us, but it also impacts our communities that we travel through, and we have a place in on a daily basis. Take care of yourself. Don't take on more than what you can handle, and just be vigilant in addressing mental health issues, because they can become impactful. Your mental health is important.